I'm Maggie Danish, and I did my project on the diversity in health and illness within the Arabic culture. Arabs come from 22 different countries, however are unified by a common language of Arabic. Following Arabic as the official language, English comes in second. Early Arab immigrants came to the U.S. between 1880 and 1913 and were all primarily of Christian religion. After 1965, however, most Arabs immigrating to the United States were Muslims who came for a higher education. Communication between Arabs is very direct, professional, and often loud. Family life is somewhat strict. Wives' interactions with husbands are very formal, and their duties usually are minimal and only involve childcare and interaction and housekeeping. The men carry basically every other role, including decision-making, protecting, and breadwinning. Children are very much appreciated, however they are held to decently high standards in the sense that they must succeed academically, and if they are to disrespect their elders or not follow the rules, they can be physically disciplined. Failure academically or social delinquency can bring great shame to the family. Once parents get older and have health complications, their sons are responsible for treating them within the home, not a nursing home. The family in Arab American culture is very important as a unit that sticks together. Family members often help one another, and most families live nearby one another so that they can assist with whatever they can. There is a hierarchical family structure in Arab American families, with older members earning the most respect, and sons and fathers taking over the majority of the responsibilities, which is often why male offspring are preferred to female. There is much criticism and discrimination that comes with being Arab. Unfortunately, many are thought to be suspicious or too aggressive and argumentative. When this criticism is portrayed towards Arabs, it can be taken personally as an attack towards their family order. Two large health risk behaviors that Arabs partake in are sedentary lifestyles as well as avoidance of screening for certain diseases. Many Arab women avoid cervical and breast screenings due to modesty, which can unfortunately be dangerous. Many women also fear being diagnosed with illness because they fear it could bring shame or influence their marriageability status in the community. Sedentary lifestyles can be dangerous as it raises the risk for chronic diseases very highly. In the Arab American culture, there are many health beliefs that differ from what we often see in the United States. Some include the celebration of Ramadan for Muslims, which includes a long period of fasting for 29 to 30 days from dawn until sunset during the 9th month. Arabs who are sick and are hospitalized during Ramadan are not required to participate in this fasting. However, most continue to do so anyways. Although it is respectful for their religion, this can be dangerous while the body is already in a fragile state. Another health belief is the stigma surrounding disease. Disease can be attributed to environmental causes, such as hots and colds. However, they also can be by evil spiritual forces, or specifically the evil eye, which is pictured to the right. Beautiful, healthy women and children are most susceptible to this so-called evil eye, so often they will wear blue amulets or other jewels to protect themselves from it. Arabs' health beliefs when dealing with mental illness differ greatly from what we normally see in the U.S. Mental illnesses often carry a bad rep and can be attributed to bad spirits, and treatment with medication is preferred to counseling, unlike what we see a lot of the time in the United States. Another health belief surrounds the ideas of birth control. Irreversible forms of birth control like vasectomy or tubal ligation, also including abortions, are absolutely unlawful in Arab culture, unless the individual's life is being compromised and the possibility of having a child is life-threatening. Lastly, doctors of the same sex is often preferred to Arabs, because it can feel embarrassing or awkward to have the opposite sex examine them. Some women often refuse to even be seen by a male physician. With a lot of these health beliefs, there is an underlying theme of embarrassment and modesty. Many people in the Arab culture are either too modest to face the truth of disease and illness, or they feel embarrassed seeking assistance, which all leads back to family and proving to family that you are strong and worthy. It is unfortunate, however, because with these beliefs also probably comes a lot of issues that are never addressed. The outcome of an individual's health may end up depending on whether he or she wants to speak up or not, which can be dangerous if the choice is no. It can be tricky when giving recommendations to another culture to improve their health, because you do not want to disrespect another's culture or beliefs, but at the same time you want to give them advice that they could hopefully benefit from and utilize in a way that is not offending their culture. One thing important for Arab women specifically is to speak out. Arab women are unfortunately just used for most of the time for housework tasks and raising children. However, a woman's health is just as important as anyone else's health. Another recommendation to this culture in particular is to educate them on the benefits of mental health counseling, rather than just taking medication, and to inform them that it is, in fact, such a common issue that so many people deal with, and it is not evil, nor it is something to be ashamed of. I understand that explaining this to someone of a different culture may not be as easy as it sounds. However, educating them and showing them that people all around the world deal with the same things and handle it in different ways that benefit them can hopefully benefit that culture as well. A last piece of advice to people in the Arab culture is to feel as comfortable as you can in a healthcare setting with a physician or nurse. A woman's modesty is greatly respected. However, it is helpful to always remember that physicians must follow many confidentiality laws. Therefore, your information is not going to be spread across the hospital and back to your community. A place of healthcare is a place of safety and confidentiality. So although women may respect their modesty and may not want to feel embarrassed in front of physicians, they must remember the confidentiality that all of these healthcare workers hold.